A combined team of small-scale mining task force and the Central Region Police have arrested 15 illegal miners who were mining on the Ofin River. The clampdown, according to the team, is to reinforce government's fight against galamsey and also to protect the rivers and water bodies in the Central Region. Richard Kujunyako has more in the following report.
The activities of illegal miners on the country's rivers and water bodies were one of the main issues that provoked government fight against galamsey. For a period of 6 months, government has banned all small-scale and other illegal mining activities. An anti-galamsey task force has been set to police the environment to ensure that government's commitment to the fight against galamsey was carried to the letter. But while many others have agreed to government and other anti-galamsey pressures to halt galamsey activities, there are many others that cannot be boarded. On the Ofin River, one of the major rivers that serve people in the Central Region, many young men, their ages ranging between 16 and 42, were spotted on their machine digging and polluting the river. Many bolted upon seeing the police and the task force, while 15 of them were arrested by the task force. Central Region Police Commander COP David Nenyi Ampabenyin has been speaking to JoyNews.
Upon a tip-off and consistent meddling of the Ofin River, laid ambush and identified these people. There are about 15 of them. They were in the machine on the top of the river, mining, and in that sense, mining the river. Police were able to arrest 15 of them. Others escaped by swimming in the river. We want to sound a note of caution that in as much as we are waiting for the vanguard to take off, people who want to secretly mine in our rivers, we will apprehend all of them and they will be made to face the full rigors of the law. The small-scale mining association in Dukofin and its environs, in conjunction with the police, are behind this arrest, and they are working tirelessly to ensure that those who have gone on the river where police cannot reach, they are being exposed and arrested.
Inculcate social media in the fight against corruption, and that's a charge by civil society groups to the youth of the country who have been urged to use all available social media platforms to shape the anti-corruption discourse. For organizations like the Institute of Economic Affairs and the Ghana Integrity Initiative, the youth could play a key role in the corruption fight, or by channeling their energies into productive campaigns to deal with the vice.
Society groups have decided to take the campaign against corruption to the tertiary institutions where there's the belief much of the individual's modeling and character formation are enhanced. It is in this light that, as part of events to mark this year's Anti-Corruption Week celebrations, an inter-tertiary schools debate was organized by the Institute of Economic Affairs, IEA, with support from the U.S. Embassy. Participants argued on the role of the Rights to Information Bill and the Office of a Special Prosecutor in fighting corruption.
If we pass the Right to Information Bill, people who engage in corruption in the first place would even be afraid to engage in corruption because they know that at any point in time, someone can come and demand a relevant information that may subject them to public scrutiny. If you look at Article 884, all right, that is where they say that under that clause, we are establishing the special prosecutor. Now that gives the Attorney General to delegate powers to the special prosecutor to undertake his mandate. But one thing that we are forgetting is that it is under the Attorney General. The appointment of such a person is going to be done by the Attorney General and the President. How are we sure about their independence?
How do you know that every information presented to you is the right one? Even if some has been withheld, how would you know? A special prosecutor can investigate and prosecute the alleged victims.
Representatives from the University of Ghana immersed victors with their articulated position on the role of the Right to Information Bill in fighting corruption, winning the judges over. For research fellow at the IEA, Professor John Asafo-Ajayi, it is time the youth maximize the use of social media in the corruption fight, which is a platform with the potential of chalking maximum impact.
We also saw in a number of instances where cases of corruption had been uncovered, and social media was one of the media by which it was quickly spread. So that's one way of getting information to the people, and I believe it has a crucial role to play. I would encourage the youth to take advantage of it. That's where we can get the maximum impact.
He's also been underscoring the need for civil society groups to intensify their campaign against the canker.
Some of the CSOs, we can actually contribute by getting some of these students to do internships, for example. Because at the IEA, we do a lot of work on corruption. Usually we write policy papers, we do research, and I believe that if the CSOs can engage as many students as possible in this sort of activity, that will contribute to the education, and also obviously if you train one person, that person can also train another person, and that way we can actually spread the awareness. Also, we can make them aware of, apart from their rights, what is corrupt behavior and what is not.
Does cultural and social construction partly contribute to the endemic nature of corruption? Well, Professor Asafo-Ajayi clearly believes so.
The problem has to do with the culture, whereby gift giving is seen as gift giving is expected, right? So sometimes the culture of gift giving is interwoven with corruption. Also, a lot of people are not aware of what is corruption and what is not. For example, if someone is demanding favors, they may not be aware that it's corrupt behavior, right? Especially if the favor involves breaking the law or breaking a procedure. Yeah. So I feel a lot of it is due to lack of education, and this is where the fight really should be intensified.
One of two representatives of the winning University of Ghana debaters team, Gerald Ahin alias Dachehene, wants the posturing against corruption by all to be aggressive.
Corruption curbing is a priority to me as a political science student. If I become a future politician and corruption has damaged this country, it wouldn't augur for me at all. So I found it very important to contribute in any way that I could to ensure that corruption becomes, as our former president would say, a thing of the past.
Out of the 4 schools that partook in the debate, Central University came second, with Accra Technical University and the Islamic University tying in third. Organizers are hopeful this would mark a start to a whole new phase of the fight, likely to achieve quick results.
University of Ghana wins this very one. Congratulations!
The Health Minister, Kweku Agyeman-Manu, has come under heavy criticism from members of Parliament for what they say is his poor management of the disease outbreak at KUMACA Academy in the Ashanti region. They claim leadership at the ministry is managing the cases ineffectively. Official figures already indicate that 8 students have so far died from the mysterious disease since March this year. The minister, who was summoned to Parliament over the issue Wednesday, told members of Parliament and experts that they are currently working to contain the situation.
There's no leadership. He could have on his own held press conferences every 5 to 6 hours to brief Ghanaians what actions are being taken to contain the situation. We are not seeing this. What do you want parents to do? To sit back home? No, they can't. They have to rush there to see what is happening to their wards. And this is dangerous for everybody. It is dangerous for everybody. It is not the headmaster who has to tell parents, don't come and take your kids. No, no, no. Why? It is not him. It is those who know or who should know that should tell parents what to do in situations like this.
So the authorities have failed?
They have failed miserably. It is a miserable failure on the part of healthcare leadership, led by the Honorable Minister. He has failed completely. And there's nothing that can exonerate him from this massive failure.
What would you have him do?
Why are the results not yet in. There must be an emergency response to public health disasters of this nature. And so if you do not trigger those responses, your results will be delayed. What can be done now is to make sure that we have a clinic on site, that we quarantine the area, that we move most of the students to a side camp and fumigate the whole place. That is what we have to do.
Surveillance has been intensified throughout the municipality, not only in the school. Records review of OPD register at the school sick day is ongoing. All cases being referred to KUMACA hospital and others from the sick day. That is what has been designated. So we try as much as possible to advise that all cases should go to this hospital. Follow-up visits on cases at KUMACA and Kofanochi by the team that is at the moment handling the matter. Line list has been developed for suspected cases. Emergency meetings have been held between health and the school authorities. A team from the national level deployed to support the region and the district to support their response activities with the following terms of reference. To ensure there is adequate logistic support to the region and the affected municipality. Mr. Speaker, as we speak, we have managed to send close to about 100,000 Ghana cedi for these initial public health interventions. To establish epidemic in KUMACA, stop further transmission, to ensure effective case management, to protect school population at risk, to educate the school population, and to submit reports with recommendations to prevent further occurrences to the public. The Regional Health Directorate is requested to provide additional support to the sick bay and to deploy a medical officer, preferably with a public health background, on temporary basis for about a month until the situation normalizes. For now, we are doing chemotherapy, prophylaxis, trying to give whatever medication that can prevent further infections to the students in the school. Unfortunately, last night, Mr. Speaker, what information came up was that parents have taken the awards from the school, and this has become another health challenge because the medical advice said that we should contain them in the school and manage them more efficiently. So the problem we're now having is that if the disease is confirmed as a very contagious disease, then it will mean those who have come out of the school into their family homes are also going to help spread the disease. So that is the challenge we are confronted with at the moment.
Meanwhile, Alhaji Muntaka Mubarak, who is a minority chief whip and member of parliament for Asawasi, where the school is located, is pushing for closer collaboration between the ministries of education and health to resolve the problem.
Me as the MP, the school authority, all of us who are so close are getting direct information. You panic. The simple reason why you panic is that you know that if they don't know the cause and you ask the children to go, there could be these consequences. If you keep them in school and the causal agent that is causing this disease is within the school, more students will be affected. So it's like you are torn. Which are you doing? But I think that with the broad spectrum antibiotics, which slows down whatever disease that it may be, it is better the children come to take the antibiotics and probably go home. So that we'll all be monitoring, maybe within the next few days, if they're able to know exactly what the problem is, then we know, oh, you're staying home is not useful, so come back. Oh, you're staying home, or even the rest that are on campus should all move out for us to take ABCD action. So that's why it is difficult and you are seeing this contradiction, because depending on what you say it is, it may not be necessary for them to evacuate the school. It may also be necessary for them to evacuate the school. So that's why the dicey. But I think that the Minister of Education, Minister of Health should quickly put their heads together so that they'll be able to take a tentative decision. Because when you allow the Minister of Education, they don't have health background. All they think is that, can we evacuate the school so that it will be easy? Everybody is with his parent, so that even somebody is sick and is with his parent, maybe the parent can take the person to hospital faster. They will be looking at it. But if you are from the health background, you know that allowing the children to go, if the disease is the type that can spread through body contact, you'll be doing more harm by allowing them to go. So they should come together so that they will take a definite decision not to do this front and back and creating more panic in the minds of parents. Because the students, you know the way the school selection system is. Someone may be coming from Novrongo is there. Somebody is coming from Takoradi is there. Parents hearing this on radio, obviously, can you imagine the confusion that you are putting there? So the school authorities, together with the ministries, should be able to take a tentative decision that they think will be in the best interest of the children and the school.
And still on health, a hospital's ability to deliver quality health care is severely impaired when it lacks medical supplies. Sadly, though, this is the situation in which many health facilities in Ghana find themselves, and this is due to the failure of the National Health Insurance Scheme to reimburse them for attending to its subscribers. Officials at the Bable Polyclinic in the Upper West region, the Savelugu Hospital in the Northern region, and the Evangelical Church of Ghana Hospital at Bandai say they have all not been paid for the past 16 months. Jojo Kobna assesses how non-payment of insurance claims is affecting healthcare delivery at these facilities.
The polyclinic in the lower district of the Upper West region. From the outside, everything looks glossy, but a closer look reveals empty shelves in the pharmacy. Health workers here are not happy with the situation because they've been forced to tell the public to get medication elsewhere. At the Evangelical Church of Ghana Hospital at Pandai, the hospital lacks essential medication for emergency surgeries such as cesarean section, so patients are forced to dig deep into their pocket to buy medicine.
What time do you think this woman will start?
It depends on the time that
the doctor will finish.
No, they will bring the drugs from time.
These people drug, but you don't have drug. What kind of drugs?
The infusions
like Rangers, normal saline, and then
you don't have them.
Yes.
How? What happened?
But the insurance is owing us and they are not paying us. For the past 18 or 16 months, the insurance is not paying us. So we are doing our own pakapa to run the place.
Medical Superintendent of the Evangelical Church of Ghana Hospital, Dr. Sonla Joseph, is very unhappy. He has been sued by 2 pharmaceutical companies for failing to pay debts.
And over 98% of the clients who come here have health insurance. And we submitted July 2016, 20th of September 2016 last year. And up to now, no payments have been made from this. We are no longer credit worthy. Suppliers will not give us. And those who have supplied us that for a very long time, because insurance owner will not be able to pay, have sued the hospital in court. And among them, Tobinco Pharmaceuticals has given us a demand notice for us to pay the money, and they gave us 2 weeks. And the amount they were demanding, even if I sell the hospital, I can't even pay. The second company that sued this hospital is JY Pharmacy. JY Pharmacy also sued the hospital and demanded payment of their monies. And that again had to stop working in the hospital and move to the region, Tamale, to negotiate out a court settlement.
Staff to be paid from internally generated funds have not been paid for more than a year, and SNIT has taken a legal action against the hospital.
Just some few weeks ago, SNIT dragged me to court, Yendi, because I've not been able to pay the few staff that are on IGF their SNIT contribution. Again, I had to go to court to explain, and it took the judge to have reasoning with me and pleaded with In fact, it wasn't a plea. The order Senate that if insurance owed the hospital, what do you expect doctor to do? At least have a roundtable discussion and negotiate a way out. And that is what is giving me some briefing space. And so I am supposed to run a hospital, provide health insurance service to the people, but the government agreement in terms of the national health insurance thing is not coming, and it makes me get frustrated.
If the National Health Insurance Authority fails to redeem payment of hospital claims, many facilities will continue to suffer. Jojo Kobna, Joy News.
And that's it for the news. Please let us know what you think about all the stories we've been doing, but we have a lot more news. So we'll be doing a review of the newspapers when we come back.